Hi, I'm Samantha Peck, Executive Director of Family Councils Ontario. We are living through an unprecedented crisis. The novel coronavirus COVID-19 has changed the ways we live and work. Our long-term care homes are no exception to this. Long-term care homes are an essential part of the healthcare system and one that has been deeply affected by this virus. Since March 13, 2020, long-term care homes have been closed to visitors. While most families understand the need for this in order to keep residents and families safe, this decision has not been easy. Not only do in-person visits enable families to care for their loved one in long-term care and provide essential social connection between families and residents, families also play an important oversight role as the eyes and ears of the public. Not being able to visit in person removes all of this. Long-term care homes and other congregate living spaces have been more affected by COVID-19 than hospitals or the community. And unfortunately, many of our long-term care homes have seen outbreaks of COVID-19 and resulting deaths. To help combat the crisis, the provincial government has provided emergency funding to long-term care homes and has made emergency staffing measures that provide flexibility in staffing. This order, dated March 27, 2020, was designed to soften the legislation, Long-Term Care Homes Act, in order to provide flexibility to homes so they could access a larger pool of people who have relevant skill sets for the vacant positions. This was also done to decrease the amount of documentation required, therefore releasing more time to direct care for residents. As well, home staff are now limited to working at only one site so as to reduce virus transmission. These are measures that will help save lives. You can read more about these and other measures on our website. What we're hearing from families is that you want to see more testing of all staff and all residents. And we are continuing to share this concern and others with the Ministry of Long-Term Care. In addition, we have created and released, along with our partners, the Ontario Association of Residents Councils and Tech Coaches, a new virtual visits toolkit. Homes can use this toolkit to set up video calls between families and residents. And we supported the development of a tool that helps you think through the very tough question of whether or not to bring your loved one home from long-term care. So, what can you do to navigate this crisis? First, continue to use physical distancing practices to keep yourselves, your families, and your community members safe. Your health and well-being are important. Connect with your peers to give and receive support. Our weekly virtual family forums can help you connect with other residents' families for support and information sharing. And use creative ways to keep in touch with your resident. Ask your home if they have set up video calls between residents and families. If they haven't, ask them to get in touch with us at FCO for help. We created the Virtual Visits Toolkit to provide the guidance and support needed to get video calls set up. Use window visits to safely visit in person. Drop off care packages if you can. Call or email your loved one. And work with the home to get the information you need. We have resources on this posted on our website that will help homes think through what information to share with families. Continue to get in touch with us to ask your questions and share your concerns, or just to talk. We're here for you and will continue to share your questions and concerns with the government. We are in this together and we will get through it together. Thank you for watching.